and welcome. I'm Maloni Bhatt, and this is a special conversation with one of the jury members of the ZS Prize. Founded in 1983, ZS is a management consulting and technology firm focused on transforming global healthcare and beyond. It has instituted the ZS Prize to nurture ideas which can solve some of the complex challenges of healthcare access and affordability in India at scale. And I'm very pleased to welcome one of the jury members of ZS Prize, Dr. Farzan Engineer. Dr. Farzan is a co-founder and chairman of SiteCare Hospitals and co-founder and joint chairman of Medwell Ventures, which offers home healthcare services under the Nightingale brand. His career in healthcare as a professor, entrepreneur, and researcher spans 3 decades. He's also on the board of various companies. Farzan, it's very good to have you here with us today.
Thank you for having me. It's a pleasure.
From your vantage, can you set out the key healthcare challenges that India needs to address in the next decade so that we can provide quality healthcare, affordable healthcare for all?
Well, let's start at the beginning. Number one, we need a far greater focus on preventative healthcare and early diagnosis. If successful, this can have the greatest impact on our nation's health and, importantly, at the least cost, both human and financial. As part of a cancer hospital in Bangalore, I routinely see patients who we can easily cure, except that they have come in too late. Therefore, our cancer outcomes in India, our curative outcomes are roughly 25-30%, whereas in some Western countries, they're above 50%. And the primary reason for this is we don't catch the disease early enough. Number two, we also need to increase our public expenditure on healthcare, which, as per the latest economic survey, is only 2.1% of GDP. The substantial increase would help fill gaps in critical healthcare infrastructure, particularly in our rural areas. We also need to address the shortage of doctors, not just in terms of numbers, but also in terms of quality, specialization, as well as some sort of an equitable distribution in different parts of the country, both rural and urban. Number three, and I think this is a really important issue, and it is that of healthcare insurance. This is key to making healthcare affordable to all, which is one of the problems that we are trying to address here in a big way. According to NITI Aayog, roughly 420 million people, which is about 30% of our population, are uninsured. I would reckon that an equal or greater number will also be underinsured or inadequately insured, particularly for certain types of disease. There is therefore an urgent need to increase coverage across diagnostics, medical care, surgical care, post-surgical care, home health care, the whole gamut of treatment which people need. And I think, and some of this has started already, the government has to work much more closely with the private sector. And I also think the rules governing insurance need to be modernized and updated so that this enables what we're trying to achieve here, which is healthcare for all, affordability for all. And I think only a robust insurance system can achieve this.
These are significant challenges, the ones that you placed. I want to speak about doorstep healthcare. You also mentioned that there's this shift that's happening in the healthcare industry. What would you say are the challenges in delivering this, patient-centric and accountable healthcare, which can also leverage technology?
See, let's look at India's senior citizens. Our population, senior citizen population, is expected to grow to about 325 million people by 2050. That's about 20% of our expected population of about 1.66 billion by 2050. The burden of chronic and the so-called lifestyle diseases, such as cardiovascular disease, cancer, and diabetes, is expected to rise to about 74% of total deaths by 2030. So the mortality from these diseases has increased or is expected to increase very soon to 74% versus about 56% in 2008. Home healthcare is therefore needed for multiple reasons: to decongest our tertiary care hospitals, to reduce hospital-acquired infections, to reduce costs, both in terms of time and money associated with hospital visits, etc. Various challenges need to be overcome. We need a regulatory framework for home healthcare which will drive standardization and protocol-based care. Number two, we need a trusted platform which provides transparency and visibility on outcomes so that we gain the trust of insurance companies, consumers, regulators, and the whole ecosystem. We now have the requisite technology, miniature devices, cloud-based solutions, and what have you. Plus, we have huge learnings from the pandemic experience. So this is less of a constraint now. I think what we need more is backward integration in terms of creating a pool of trained manpower to execute and deliver on quality home healthcare. In summary, a modern regulatory framework, insurance coverage, and clinical standards will help drive this important sector in India.
Doctor, from your vantage, do you see this already happening? And and is the pace of it adequate?
Early days. It's very early days for this segment, but its importance cannot be underlined. I think everything that can be done outside the hospital to the same quality and the same level of reliability should definitely be done. We are at an early stage in our country, and some of the points that I mentioned can certainly help accelerate where we need to get to.
Focusing on the ZS Prize, solving for India, that's the big theme. You mentioned, a lot of challenges that we face. Where are the opportunities for transformation, disruption of healthcare in India? And how do you see something like a ZS Prize catalyzing healthcare innovation, for rural India, for Bharat?
The ZS Prize serves as a platform that advances healthcare in India. And there is a very concerted focus on not just disruptive tech-based healthcare solutions, but also in terms of enabling frugal innovation. Number two, due to its size and diversity, the ZS Prize has the potential to inspire innovators across India and to solve challenges of healthcare across both rural and urban India. The sheer scale of participation during the inaugural session, the first time we did this prize, saw over 33,000 innovators in India participating, with about 2,800 healthcare ideas. And in the second session, in the second edition, if you will, we hope that this will be equal or even more. So this really ignites the minds of a very large pool of healthcare innovators, not just in some of our established innovation centers, but across our country. The prize provides dedicated mentorship, which I think is very important. It provides funding as well as national recognition. It encourages, helps, and supports our healthcare innovators to bring scalable, sustainable ideas to life, to solve real-world healthcare problems in our country.
So this is the second year, the second edition, where you will be judging the participants of the ZS Prize. Is there any advice that you'd like to give them, before they kind of undertake the challenge? Are there any expectations that you have from the second edition?
It's a great question. I'm sure we will continue our focus on a number of things. The first will be a focus on building healthcare solutions that improve access and affordability. We will continue our focus and our passion for solving healthcare problems at the grassroots level for the masses. We will perhaps emphasize even more patient centricity and the importance of preventative healthcare. The ultimate objective would be to gain the trust of consumers and customers. We will also continue our focus in terms of encouraging the use of technology for smart interventions to make healthcare more efficient, more affordable, and more reliable. So I think it will be a continuation of a lot of themes that have worked for us and what we believe in and what the prize stands for, with perhaps additional emphasis on patient centricity.
Okay. In your journey as a healthcare researcher, innovator, entrepreneur, can you share, some of your learnings, mantras, if you will, which have helped you be where you are?
Well, each of these have been learning experiences, they've been great journeys. And all three projects, interestingly, address healthcare needs in India in different ways. I've learned to address challenges related to cost, quality, and scale. These days, though, I am learning a lot from the startup world in Bangalore. I'm associated with a number of great, very early stage companies. And they combine three things, in my opinion: deep science, and we get a lot of help from the government and quasi-government laboratories, like CCAM, for example, which are world-class and are really great places to incubate some of these ideas. Number two, a passion among the entrepreneurs to solve problems across India. There's a deep passion not just to build a business, but also to solve real-world problems, and that is very heartening to see. And the third is an ambition, which is global, which is to do frugal innovation in India, and to actually give effect to what one might call reverse innovation, where in India you can fail fast, you can try a lot of things, figure out what works for your country. And hopefully it also helps people across the world. And it also helps us build global companies. This is particularly why, at least I'm excited to be part of this prize.
All right. So it's basically build in India, but you solve for the world.
Yes, correct.
All right. With that, Farzan, thank you so very much for your thoughts and for your time today. And we wish you all the very best for the second edition as a juror of the ZS Prize.
Thank you. Very excited to get started.